Hello and welcome to India Top Doctors. Today we will talk about oral hygiene benefits and its requirement for well-being in general health. Oral hygiene diseases refers to disease like cavities, gum disease and oral cancer. If you have any problem in your gums and teeth, then it should not be ignored. Sometimes the problem increases so much that there is a problem in eating or drinking anything. To understand more on this, today we have our guest, Dr. Sumit Arora, who is a very well-known dentist from Gurugram. So let's welcome him. So welcome to India Top Doctors. As you know, today we will talk about oral health. So
Mhm.
before we move any further, can you tell me something about yourself?
So we are practicing in city Gurgaon since last 15 years. I'm a dentist by profession, and my wife, she is Dr. Arora. She is also a dentist by profession. I'm Dr. Sumit Arora. So we have been practicing in Gurgaon since last 15 years. Our clinic is in South City 2. It is in V Block Market. So we have quite a big practice. We have 4 chairs in our clinic, and we practice all multi-specialty dentistry from starting from child to adult, and anything which is related to dentistry, anything which is related to your teeth is practiced in our clinic.
Okay, very nice. Can you tell me the connection between oral health and overall health?
Overall health and oral health, it is actually very directly related. People generally don't know that generally people don't have an idea that how the oral health can affect the overall health. So what happens generally when you have a bad teeth, or you have a calculus or a tartar or a dirty mouth, you can say, when people don't have a very hygienic, they don't actually follow all the rules and the way the teeth should be clean. They don't visit the dentist for the cleaning. So whenever they have such a situation, so it means that they have a bad oral hygiene. Neither they brush at home properly, neither they visit a dentist for getting a professional cleaning done. So what happens slowly and slowly? So when you are young, it does not matter at all. Means it matters, but it's not much. But as you grow older and older and older, oral health start affecting your general health. So now what happens? It affects a bad oral health affects your heart health. It affects your lungs health. In pregnant women, it also affect the fetus, and there are studies and there are data all around the world that a bad oral hygiene can actually lead to the abortion, in pregnant ladies. So it is so important. Like, people generally develop cardiovascular disorders just because of the oral health. If in case they don't have a good oral health, they have bad oral hygiene, it affects their heart, it affects the kidneys, it affects the lungs. So people generally don't have an idea that how it affects, because people generally relate oral health means it's only related, only limited to your oral, only limited to your mouth. But it is not at all like that. So nowadays there are a lot of studies, a lot of data that a bad oral health will definitely reflect your oral health, and one should must give a priority, I would say a number one priority, to the oral health. If in case they have a goal of staying healthy, staying fit, and if they are eating well, they are going to gym, they have a healthy lifestyle. But if in case they have a bad oral health, I'm sorry, everything goes for a toss.
What you said
So it's very
was
important.
really, yes, it was really very different from what I have generally heard. And I guess it would be very useful for our audience. Can you also tell our audience about the benefits of oral hygiene while we are at it and how we can protect our oral health?
Benefits, obviously, the number one benefit is like what a layman understands about oral health. That okay, when he has a bad oral health, so the first sign he encounters in his day-to-day life is that okay, someone can say okay, your mouth is smelling, or you're not smelling very good. So that's the first indication that a person actually starts having an idea that okay, I may have to visit a dentist, or I may have dirty teeth. So that is the first indication. So that is very important, because obviously a layman understands about a bad oral health only when he has some issues with the smell part, or the overall looks of his teeth. For example, people who are smokers, people who have bad habits of having tobaccos, chewing tobaccos, or red wines or coffees. So these people actually come to know about the thing about a bad oral hygiene only once they start noticing that okay, their teeth are getting palish, their teeth are getting stained, their teeth are getting brown. So these are the indications, like a layman, as a layman who understands that okay, something is going wrong with my teeth. So this is, but overall, if you see, it's not only about the factor that okay, the beauty part of the teeth, or the looks part of your smile. Bad oral hygiene, that is one of the issues which has to be considered, and obviously the teeth are professionally cleaned because of that reason. But the overall, as a medical standpoint of view, obviously there are a lot of other reasons, as I described just earlier, that if in case you are developing diabetes, if in case you are having you are moving towards a bad overall health, and which coincides with the bad oral hygiene of yours, you must go and get yourself checked to a dentist. Because if in case you are taking all the other treatments, but if in case you're not keeping your mouth clean, mouth, when I say mouth clean, means that you have to actually go to the dentist for a professional cleaning. Because what you do at home is just brushing, and brushing generally removes the soft plaque. But from months after the months, when you keep because your mouth is a grinding machine, it is a kind of a, it's a place where your food, you chew your food. So obviously you're slowly and slowly your mouth develops scales, like in any machine. Like if even if you do your washing machine, you know, when it washes the clothes, it develops scales, and you need to go for a descaling. So in the same way, your mouth always develops scales, and that scales have bacteria. You must go to a professional, you must go to your dentist and get your teeth cleaned once in 6 months to make sure that you don't have all these issues, so that you got yourself descaled, you got yourself free from bacteria. And then obviously you must start having good hygiene at home as an addition.
So that's a tip to visit dentist. Everyone should visit dentist, obviously, but
Everyone should, once in 6 months is very important. Like just like a general health, you must go and assess yourself. You must go and show your mouth to a dentist. Let him analyze, let him assess, let him give you the assessment of okay, how your mouth is, and how, whether you have some cavities, whether you have a good hygiene. Are you doing the brushing in the right way or not? You know, is your brushing helping you or not? You know, so this is very important, because generally people visit dentists only once there is a problem. And obviously everybody generally, it's a common perception that nobody loves dentists, nobody wants to visit a dentist. So it's very important that you should it is, if you what I say, that if you want to avoid a dentist, you should start visiting a dentist regularly. That's the only way you can avoid a dentist for a bigger problem.
absolutely right, sir. But can you tell me some of the best ways to practice good oral hygiene at home itself?
So at home, it's very easy, but the main thing that if I say you must brush twice daily, you know, so people generally know about it, and they also there's some people who actually practice. The thing is that sometimes you don't brush properly, you don't have a right technique to brush. So nowadays you can find a lot of videos on YouTube, you can see a lot of videos on social medias, that you can actually have a look on the videos and learn how to brush with the right technique. So for that, I need not tell you here, but you have a lot of videos available, and you can find a good video where you can actually learn the technique. So apart from technique, it is very important. So the brushing should be 2 times in a day minimum. So once you should be brushing after breakfast, which generally people do before breakfast. Okay. And once you should be doing after dinner. So now once you brush after dinner and you wake up in the morning, your teeth are already cleaned. Night brushing is very important. So when you wake up in the morning, your teeth are already cleaned. For the freshness of the mouth, some people say that I can't eat anything unless I brush. So, okay, it's good. If you want to brush before meals and then after meals, that's good. But if in case you just want to brush once in the morning, it's better to brush after your meals, after your breakfast. And once you wake up in the morning, with and for the freshness in the mouth before your breakfast, you can use a mouthwash, because
Right.
practically your teeth are clean. And if you use a mouthwash, your mouth will become fresh. So you have your breakfast, and then after having the breakfast, when you clean your brush, when you clean your teeth with the brush, so you will see that till the lunch is for next 5 to 6 hours, you're keeping your mouth cleaner as compared to if you would have brushed before the breakfast. So for the whole day, out of like 12 hours of your daytime, if in case you are managing to keep your mouth clean for 5 to 6 hours by brushing after the breakfast, then you are actually keeping half of your time, half of the time of the day without any kind of deposits on your teeth, which drastically reduces the occurrence of cavities, the occurrence of dental and oral problems.
All
And
right.
in the night, you should be brushing definitely. So in the night, the brushing should be the last thing before you go to bed. So you should not be snacking anything, you should not be drinking anything. The brushing should be the last thing before you hit your bed. And of course, flossing. So flossing is very important. So generally people don't understand the meaning of floss, they don't know how to do it, they don't know how it is available in the market as a tool, how it looks like. So many people doesn't know about it. So the floss is a kind of a thread. You can also see online, you can see the videos online, how you can use the floss. And these are the tools which you should be using to clean between the teeth, between the teeth. So it is just, for example, if I have my fingers like this, and if I say that if I wash my hands only like this, then it's not a right way, because I am not cleaning between my fingers. So to clean my hands, I have to actually clean like this so that I can clean in between the fingers. In the same way, your teeth also have spaces. So while you have one tooth, second, third, fourth, so they have spaces in between, and that space is very tight. So when you chew, your food do get deposited in between those spaces. And if in case you're not removing them, what floss does? Floss actually is a kind of a thread which actually goes inside your teeth. With the pressure, you just push it inside and just pull it out. So with the friction, it takes out all the debris between your teeth. So that is very important, because most of the cavities which are developed are between the teeth. People generally, even people who are brushing 2 times a day, they still develop the cavities because they don't floss. And the cavities develops between the teeth unnoticeably. You don't even notice them, you don't even see them, because they are in between the teeth. You only come to know about the cavity when it starts paining. And then you see, when you seek a dentist, when you go to the dentist, even sometimes we also don't see where the cavity is. We have to take x-rays to see where exactly it is locating, because it's between the teeth. So if you are brushing between, if you are flossing between the teeth, it is, you are going to you are developing such a good habit that which will drastically reduce your dental visits to a dentist throughout your life. You will see that you will rarely get any problems in case you're brushing 2 times and you're flossing. So flossing can also be done once or twice a day. In night, flossing is really more important. If in case you can bit of flossing twice, that would be great. If not, then at least once in the night, if you do before you hit your bed, it's going to be very, very beneficial for you. Very beneficial. So this is something very important. Obviously, rinsing. So once you have anything sweet, for example, in a day, if in case you have a possibility of avoiding something sweet, where after which you cannot rinse your mouth, or after which you cannot brush your teeth, better don't do that. Better don't have it. If in case you really want to have something sweet, make sure that you have an opportunity, or you have a possibility of actually brushing your teeth after that. Because once you if you eat one candy and if you don't brush after that, then in next 3 to 4 hours it creates the damage which is equivalent to not brushing your teeth for 3 days. So like three hours after a candy is equivalent to 3 days of not brushing your teeth. So you should, the sweet can obviously damages a lot, and everybody knows about it, and people generally don't. Obviously it's something like people are addicted to, people really want to have it. So I would say that if in case you can avoid, that would be good. If in case you really want to have, make possibility that you immediately brush after that, or rinse your mouth after that. Brushing is better.
Right. Now, those were really some wonderful tips you gave our audience. Can you tell me that what when a person should consider dental implants? Because we know like it's really
Dental
important.
implants is actually, it's a, yeah, dental implants, they are actually the method of a tooth replacement. So when you lose a tooth because of some infection or because of some endodontic problem means that your root got infected, or there was a failure in the treatment, or you approached doctor very late. So overall, whenever you lose one tooth or multiple teeth, so the dental implants are the best option to get a new tooth, because as your tooth has a root, this also has a root. As your tooth has a crown, this also has a crown on that. So it is the closest option, the closest to the natural tooth option as a tooth replacement method. There before implants there were other methods which were also good, but they was not perfect as implant because they used to compromise the neighboring teeth. So like for one tooth, like it's called as a bridge. So earlier the bridge was given, So and that we used to take the support of your neighboring teeth, the neighboring teeth which are healthy. We need to take their support, which is undesirable. It's, if in case we can avoid that, that's better. You should avoid bridge because it takes the health of your neighboring teeth. In the long run, it obviously compromises the health of your neighboring teeth. So implant is a good option. It is a very good option for everyone who wants to have a tooth replacement. So if you are missing with one tooth or more than one tooth, or even the full mouth, upper and lower jaw, even then, if in case people who don't want to wear the dentures, like old patients who don't want to wear dentures, that removable dentures. So if in case somebody wants a fixed teeth so that he doesn't have a removable teeth, so he can also go for the multiple implants in upper and lower jaw, and the full mouth can be rehabilitated with implants. So it's a very good option. It's a very nice. Anybody can go. Yeah, he should not be medically. The health should not be compromised. Like in diabetic patients, in highly diabetic patients, we generally avoid. With osteoporosis, we generally avoid. Patients with a lot of aggressive habit of chewing tobacco or smoking. So these two factors are also which is not favorable for the implants. So generally, it has been observed that people with habits of tobacco and smoking, generally the implants do fail. There are a lot of chances of implant failure. So that is something which is not desirable. So generally, yeah, and it's a very good opportunity for them, because I have seen in my practice people losing their teeth because of smoking and chewing tobacco. And once they get their teeth replaced with an implant, they stop smoking and they stop using these things. So they get that, gives them even the motivation that, okay, so now I will not do that for the rest of my life. So yes, these are the two factors which are generally not favorable. And the overall health also. If in case you're compromised health, like diabetes, then we generally take a lot of precautions and cautions before we do the procedure.
Okay, right. So, can you tell me how do people prevent tooth decay or other problems related to tooth? How should one prevent it? You told us about
Prevention is
tips and
prevention
everything.
is, as I told you, 2 times brushing, two
Right.
times flossing. Okay, and the time of the brushing is very important. After breakfast and after dinner, if you eat something sweet, possibly if you have there is a possibility, go and brush your teeth after that. Don't let any sugar stick to your tooth surface. That damages a lot. Second thing, visit your dentist, and very, very important, visiting your dentist for professional teeth cleaning. That is called as descaling or a deep scaling, whatever anyone needs. Some people have a lot of plaque, some people have lesser plaque. The calculus depositions it varies from person to person. So for that reason, one must visit a dentist, regular dental checkups, once in 6 months, professional dental clinic, a dental hygiene session is very important to just descale your teeth, because your brush will not be able to remove it. Only a professional dental tools can do that. So if in case, just visit your dentist, get your teeth professionally cleaned once in 6 months checkup, so that if in case you're developing even a smaller cavity, it can be caught on time and it can be just immediately filled. 2 times brushing, rinsing after meals, and flossing is very important flossing. So if you are actually doing all these all these things as a standard protocol to keep your mouth healthy. This drastically reduces your dental problems, and obviously it also reduces your visits to the dental clinic. Only
Okay.
that one visit is required in 6 months, because you actually need to visit so that you don't have any bigger problem, and you need not visit a dentist for a bigger problem. So that once in 6 months visit is very important.
And what to do when what people should do when teeth become sensitive to cold drinks or hot drinks even? What should people do then?
You see, sensitivity problem is something which, again, I tell you, there are many reasons for that. Sometimes people have sensitivity because of that, the same what I told you, when they have a lot of deposits, when they don't get them professionally cleaned. So deposits keep depositing on the surface of your tooth and your gums. So what happens when you don't get them cleaned up? So this leads to the gum recession. So your gums start receding down. When the gums start receding down, the root of your tooth start getting exposed, and the root part of a tooth, when it gets exposed, that is very, very sensitive. So that is one reason that generally people who has sensitivity. And second factor is that sometimes people have a lot of other issues like bruxism. So when you have bruxism, it's like clenching the teeth, clenching the jaws. So people have, this is kind of a subconscious condition that people generally who has it, they don't recognize they have. So sometimes it is a day bruxism, and sometimes it is a night bruxism. Sometimes it is both day and night. So bruxism means that your teeth that you clench your teeth while sleeping or in the daytime when you are stressed up, or when you are doing something in which you have a lot of focus on. So that is a kind of involuntary contraction of muscles which creates this bruxism, and which actually leads to the abrasion of the teeth. The enamel on the tooth surface gets abrased, it gets rubbed off. So when the enamel gets rubbed off, the lower layer gets exposed, and that layer is more sensitive. Third factor is that people who have a lot of have habit of sometimes brushing their teeth for quite a long period. For example, they will just take a brush and just roam around the whole house, or they will be listening to some music or some kind of a mobile phone, or some kind of news, and they just keep brushing their teeth and rubbing their teeth for a longer period. Brushing should not be done more than 2 minutes, number one. Number two, your force on your brush should not be too much, because some people have a lot of habit of actually applying a lot of force on their teeth, which actually leads to the abrasion of enamel. Again, the enamel gets abrased, it gets rubbed off from near the surface which is closer to your gum, and that creates the ditch in your teeth. And that ditch is nothing but just a kind of a abrased enamel, and the lower layer gets exposed. That lower layer is a dentine layer, which is more sensitive to temperature. So this habit should be changed. If in case some people have already developed these kind of abrasions in their teeth, they should go and get themselves checked to a dentist. If in case it is required, the dentist will put the fillings on them, on those ditches, on those cavities, on those areas from where the enamel has abrased, and that sensitivity generally gets resolved. But sometimes, if in case it does not, then there are a lot of paste available in the market which are used for the hypersensitivity of the teeth. So you can even try that. But any kind of a paste, whether it will help you or not, you should be definitely get yourself checked with your dentist first, that what's the exact reason of the sensitivity. Sometimes there can be just a deep decay in your mouth. Maybe there are one or two cavities which have gone very deep, and which is actually creating you sensitivity, so it also reflects as a sensitivity. So you may be using a lot of paste and doing everything just to mask the symptoms, but maybe there is an underlying problem which needs to be diagnosed by a doctor, by a dentist, and they need a proper treatment. So sensitivity is something like, as a layman, for a layman, it's a sensitivity, but which can be a sensitivity only, but there can be other reasons of a hypersensitive tooth which needs to be diagnosed by the doctor, by the dentist.
So thank you. That was really informative. I'm sure you have made an affirmative, a remark on our audience. Just one last question I have from you is that, as you know, COVID cases are increasing day by day, and you are a frontline worker. How do you, as a frontline worker, are taking, the COVID protocols for you and for your family as well?
So we are, since from the first wave till now, till the Omicron stage, we are, we have not let our guards down, so first of all, whenever anybody is calling to our clinic, the number one what we do is we ask them that why you need to visit a clinic. If in case we can help them on phone, I personally, I talk to them. Now I'm not even charging them anything just for that, because it is because I can't do anything on phone. So I can't, we are not even asking them any consultation fee for that, because I can't do anything. I can just, we try to analyze and we try to diagnose the problem. If in case it can be postponed for a few days or weeks till the things get settled down, and if in case they don't get a relief with medication, we ask them to come to our clinic. And before they come, we send them the protocol. There is a properly designed protocol for every patient, where we have written that only that your relatives or your dear ones needs to wait in the car. They are not allowed in the clinic. Only the patients are allowed. A child patient can be accompanied with one adult, and we don't allow anyone else in the operatory. We do only one patient at a time. Second patient is given after the half an hour gap, so that once the one patient is done, and within that half an hour, we sanitize the whole premises, we sanitize the whole clinic, and then we keep the time for the another patient. So we are not calling multiple patients at a time. We are not giving appointments to multiple patients. We are giving appointments only the ones who really are in are in dental pain or infection, or who are not able to get relief because with the medications what we were recommending them on phone. So these are the precautions, and this is the way we had been managing till now, and we had been able to keep safe ourselves and our patients as well. So we don't want, our reception is still taped. So all my chairs are still taped from the day one it all started in 2020. We are not allowing anyone to sit in the reception. Only the patients come. If there is someone along with the patients, we generally ask them to please wait outside the clinic, so not to wait in the reception area, so that we don't have a lot of people breathing in our premises. The lesser people, the better it is. So this is the way, this is the maximum what we can do. Obviously, people who are in dental pain, they needs to be monitored, they needs to be checked, because when you have a pain in a tooth, it's really extremely, you can't tolerate that. People doesn't even sleep because of that. So you have to, you have to call them, you have to treat them. We ourselves, obviously, we are using all the measures, all the prophylaxis, PP kits and everything, and we are fogging our clinic every day, twice a day. Even in the afternoon, once we go for a lunch, we just fog and just close the clinic for half an hour, 40 minutes, and then we open up, so that if in case we have air purifiers, so that we can do whatever we can do the best to neutralize this virus in the air. And when we go back home, so obviously, so the first thing is like we like the first thing is that we don't meet anyone. We go straight to the bathroom. We just go and take bath. We wash ourselves. We just do a goggles, betadine goggles, and we try not to meet anyone before we are properly cleaned and the clothes are changed. So we try to not to meet any member like that. So this is the way we had been able to keep ourselves safe, and touch wood, and by God's grace, anyone who is in my contact, at least I'm sure that I tried in this whole pandemic. We tried that nobody should get infected because of us, because of our clinic, whether he is from my family or he is not from my family, whether he is my patient or he is not my patient. So I should be the least contributor in spreading this virus, and we had made the best way we could do, and I hope it worked for everyone, for us also.
It sure did, sir. Thank you so much, sir, for you was really inspiring for me as well and for our audience. And thank you so much
Thank you
for
very much.
joining us. Thank you, sir.
Thank you very much. Thank you very much.
Thank you. And if you guys want to book an appointment of Dr. Sumit, you can do the same by visiting India Top Doctor's website. Till then, be safe and keep watching India Top Doctor. Thank you.